Everyone, so today I am going to show you a live assessment of a patient. First, can you tell us your names?
My name is Akhil.
Akhil, so we are going to record this assessment. Do you have any obligations about it?
No, sir.
Okay, perfect. Thank you.
Same compensation, the trunk is shifting on that side to maintain this pelvis high.
If you notice the distance between arm and body over here,
And arm and body over here. So we can see that this.
okay, so can you tell us about your problem? What is the problem?
Like 4 years back, I had a fall when I was in my 11th. So that time I just got a compression. So before 2 years also I had got a fall and I took an X-ray. In that it was shown that coccyx had a small hairline fracture. After that I used to get frequently pain.
Okay, so right now if I ask you like about your pain scale, while performing activities from 0 to 10, 0 means no pain, 10 means maximum pain, how much pain do you have?
Like while long sitting and all, I used to get pain from 6 to 7 and all.
Okay.
Long standing also. Normally, like if it gets reduced like 4 to 5 like that.
Okay, so let's mark this that patient complains of NPRS score 6 to 7 while performing activities, and when at rest it is somewhere around 4 to 5, and on the basis of this we are going to continue our assessment. So now we will be doing posture observation first, and then we will come to the next part of the assessment. Can you just stand over here? It's looking front. Okay. Just stand normally, you don't have to be conscious, just stand normally like how you are talking to me, okay? Just be in this position and we'll just have some evaluation about your posture, okay? So right now, first of all, if you observe, just be relaxed, be calm, relaxed, okay? So first thing what I notice over here is, if you notice the distance between arm and body over here and arm and body over here, so we can see that this side the distance between arm and body is more and this side it is less. That is the first thing I could observe. Second thing what we can observe is the length, height of the shoulder also. If you observe, this side it is slightly up, this side it is slightly lower. Third thing what we can observe here is, because of this curve we can also see that there is a pelvic drop on one side. So we can see that this side is pelvis is little bit higher, this side is slightly lower. This again we will reconfirm when we are checking the observation or posture in the side lying as well as in the posterior view. Another thing what we can notice over here is from the knee, okay, so both the knees are at same level, so nothing to worry about it. Plus we can see the position of the foot from here, so we can see this foot is slightly more externally rotated in compared to this foot. So this is what the observations are right now from the anterior view. Now let's check it from the right side lateral view. Just turn around this side and yes, be like this. Now from this view basically we can identify if there is any forward neck posture for the patient. First thing we can identify that with the help of this earlobe and the acromion process. So they are not exactly in the same line. We can say that it is slightly in forward head position. We cannot notice any hump over here in the sideline, so thoracic curve is completely normal. Apart from that we can see that okay fine, elbow is completely straight, it is not moving forward or backward, so there is no protraction retraction noticed as much. Now we need to check for the pelvic tilting. So if you observe from here, from the sideline, we can clearly see that the lordotic curve has been little bit exaggerated, and we can also notice that pelvis is tilted anteriorly slightly. So that is the main observation I would say from the lateral view. Same thing we can notice from the knee level. So knee are not in hyperextended or flexed position, okay, but I would say it is not hyperextended but slightly going for overextension in compared to normal position. Again foot remains in normal position, we cannot see any abnormality over here right now, so foot is completely fine. Okay, now we will see in the posterior view. Let's see, just turn around like this. From posterior view again we can see, we can reanalyze that from the anterior view what we were seeing. But just be relaxed, yes, relax. Okay, now we can see that this side, see the distance between arm and body, and this side we can see distance between arm and body. So again this is increased, this is decreased. Again height of the shoulder we can see, notice over here, okay, there is a abnormality, uneven height of the shoulder. Plus now if you notice here, there is a slight curvature, lateral curvature over the spine, which clearly defines, which clearly tells us about why we can see the pelvic drop and height of the one shoulder which is in the higher position. Plus let's check the PSIS. So here are the PSIS of each side. Cannot see much of the difference, but I can see that this side is slightly higher in compared to this side. These are the PSIS over here. Also from the midline we can see this is slightly up like this and this is slightly downward. Next point what we can observe here, again we can see the foot position. So this foot again going for the slight more external rotation, which we were observing in the anterior view as well. Okay, now just turn on this side. So again side view, from the other side we can notice the same thing, the earlobe and the acromion process. So we can say slight forward neck posture is there, anterior pelvic tilt clearly notified, and that also shows that there is a weakness of lower abdominal muscles, because of which we can see more anterior tilt of the pelvis. Again knee, we cannot see hyperextension, but it is like mild in more extension in compared to the normal position. And ankle looks completely fine, there is no extra curvature or there is no like pes cavus or pes planus noticed in the foot also. So that will be it from the observation point of view, from the posture analysis. Now let's move further for the further investigation. Go.
So if we look at this gait observation from the posterior view, we can see that actually there is no much abnormalities found, but I can just observe over here that still the right foot is going in the external rotation. You can again watch it from the anterior side. You just focus on the right side, you will say that right side from the hip it is going for more external rotation in compared to the left side. Rest every component looks almost normal in the anterior posterior view. After this, let's check it on the lateral view for the gait analysis. So lateral view, mainly we look for like whether patient is bending much backward or forward or not, or there is hyperextension in the knee or not. So that is not found, but again in this also we can just observe that yes, definitely lumbar lordosis is increased, and also along with that lateral rotation over the right foot. Just keep observing that. So that is my observation for the gait analysis.
Point in observation, again we are just going to check for the attitude of limb and limb length over here. So as we can see, patient is in supine lying position. I cannot see much difference in the limb length over here. I want to check the same thing in the sitting position, long sitting position also. Why? Because we have noticed some changes in the pelvis in standing position. So I just want to confirm whether it is structural or it is functional. So now just can you please sit down, just sit and relax. Okay. So can you be in this way comfortably, or it is difficult, pain increases or something like that? Little bit pain increases in this position. Okay. So this position pain increases, and if I check for the length, again length remains same. So there is no issue with like innomate movings. Like we can say the right and left innomates both are moving together only. So there is nothing wrong with that right now as of the observation till now. Now we will move forward to the palpation part. Now patient has to be in prone lying position because that is the area where patient is having pain. So first we will check for the tenderness. Just lie down on your back, lie down on your stomach. Okay, relax, just relax, comfortable, be comfortable, yes, relax. Okay, now I am going to palpate at certain areas. You can tell me whether it is painful or not painful. Okay. So first thing I am going to palpate on the sides of the spine, okay, over the paraspinal muscles. Does this pain, does this hurt? This, no, okay, this, yes, little bit, okay. So this area patient complains of little bit of tenderness here, slightly, okay, here, okay. Now I am going to check on the center part of the spine. Here anything? No. Okay, center here. Here, yes, okay. So this area patient complains of pain in the center part as well as over the sides of the spine. Now what exactly this area is, if you want to find it out, again you have to find out the PSIS. This is the PSIS level, and exactly parallel to that we can see L4, L5. So this is the area where patient complains of pain on the center area as well as on the sides of the muscle. So we can say that L4, L5 are affected because that is the area where patient complains of tenderness. So we can say that this is grade 1 tenderness because patient is just complaining of pain and not performing any wincing or withdrawing of the limb or not allowing to touch. So that is why it is a grade 1 tenderness. Now next thing what we are going to check is, as patient is complaining of pain over the lower back plus patient also has some pain over the paraspinal muscles and we have already noticed anterior pelvic tilt, we will first like to check for the tightness in the hip flexor muscle. For that we can perform Ellis test. Ellis test, we just have to do nothing but we have to flex the limb from the knee joint as much as possible and we have to notice the lift of the pelvis. So let's see now, if I am flexing it more, can we see the lifting off of the pelvis? Already it is lifted off, so we can say yes, there is a tightness of hip flexor present. Relax. Same thing I will like to check on the other side also. Already we can see, if you notice over here, the pelvis is already lifted up from the ground. That means already pelvis is in anterior tilt position, and if I flex the knee joint more, it becomes more flex. See, if you can notice over here again, the knee, when I am flexing it, it is creating more space over the hip flexor region. That means the Ellis test is positive, hip flexor tightness is present. Okay, just turn around. Yes, turn around like this. Okay. Now remember, in chief complaint, patient also complained of tingling and numbness over the right side of the limb. So that is why it is necessary that we check for SLR test and as well as slump test. Just be in supine position. Okay, like this, and relax. Okay, for SLR test passively, I have to perform this. I'll just lift off the leg, and if patient complains of pain or increasing the symptoms, the test should be positive. You don't have to do anything. I will be lifting your leg. Okay, if you have any exaggeration of symptoms, you can just let me know. All right. So I am just lifting the limb. Just relax, relax, relax. Lifting the limb up, 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 up. Do you have any pain symptoms? Okay. Now we can clearly see that patient complains of pain and symptoms aggravated in the range above the 30 degrees and below the 70 degrees. That clearly clearly indicates that patient is having disc prolapse in certain area. Okay, so that is why SLR is positive. Now I want to find out whether it is really L4, L5 or not, because while palpation we have found that L4, L5 region patient was complaining of pain as well as increasing of the symptoms. So for that I am just first going to simply perform toe extension, because if you remember the myotomes for lower limb, we know that L4 is for dorsiflexion, L5 is for toe extension. So first I will ask patient to perform the toe extension on both the sides. Now try to bring both the toes towards you. Okay, yes, lift your toes up. No, only toes you have to try to bring it up like this. Okay, yes, bring it up. Okay, so we can see, I can feel the weakness over here on the right side of the patient, that toe extension is weaker. So that again confirms that L4, L5 nerve root compression is present. So for ankle reflex, patient is in comfortable prone lying position. What I am going to do is I am slightly going to dorsiflex the ankle and then going to tap on the tendo Achilles and see whether the reflex comes. Yes, as we can see, there is a mild reflex available. So there is nothing wrong with the reflex, we can say. Okay. The next thing what I would like to check is, now I want to check for the hamstring tightness as well as if there is any tightness for the gluteus maximus or weakness for the gluteus maximus or not. So let's check that. Be in supine position, again come back. Yes, slowly relax. Yes, keep both the legs down. Yes. Now to check for the hamstring tightness, we can perform 90-90 test, for which hip and knee will be 90 degree flexed, and then we ask patient to perform knee extension actively. Just go for knee extension. Okay, this much. Can you do more? Okay, so if patient is doing more, then it is causing more pain. That means definitely hamstring tightness is present. Okay, so that is something which is present on right side. Let me check for the left side as well. Yes, go for it, up. Yes, Can you do it more? Okay. Is it painful for the back also?
No.
Okay, so left side is not that much painful for the back, but tightness in the hamstring muscle is definitely present. Now let's check for the knee to chest activity to find out flexibility of the gluteus maximus muscle. Relax. Yes. Try to bring this knee towards your chest. Can you bring it? Do you feel any discomfort? Keep your head down. Do you feel any discomfort, tightness, pain? Where exactly pain is there? Okay, on the back region as well as do you feel any pain over here?
No.
Any stretching pain, anything? Nothing is there. Okay, relax. Okay, so again this side, just do it. Try to stretch it. Okay. Do you feel any pain, tightness, stiffness? No. Okay. So again guys, we can say that there is no tightness in gluteus maximus, but there might be possibility of weakness. Okay. So guys, till now what we have learned about this patient is having anterior pelvic tilt, as well as we have seen there is slight pelvic hiking on the right side. Third thing, that SLR test is positive on the right side. Fourth thing, that yes, two extensors are weak on the right side in compared to the left one, so definitely L4 L5 compression is there. And the next thing, we found out that hamstring tightness is also present, so that might be because of spasm, that might be because of less activity by the patient, that might be because of pain also. After all this diagnosis, let's come and check the slump test. For slump test, we will make the patient in sit position, high sitting position. Just come and get up, slightly, slowly turn around, slow turn around, yes, and relax. Okay, I'll be sitting just beside the patient. Okay, first component over here is simple, that we will just simply take the knee for the extension. Okay, passively, remember this has to be done passively. I'm taking it for the knee extension. Do you feel any pain over your back region? Yes, you have started feeling pain. Okay, we'll just add one more component over here. Can you just keep your ankle lifted up like this? Do you feel more pain while doing this? Okay, so again see, patient is complaining of more pain while performing dorsiflexion. That is increase in the pain, which slump test is positive. This definitely we can see the pain for the patient. Again, this confirms that slump is positive for the right side, and again that is why it confirms that there is definitely nerve compression present for the patient. So just because we found out that there is a pelvic hike on the right side, now we need to check for the weakness in the hip abductor muscle also. For that, simply we'll just check for the Trendelenburg sign. Okay, so for that we simply ask patient to stand on one leg which is affected. Okay, now you have to weight bear on this side and lift the other leg up like this. Okay, so if you notice on me, when I'm doing this, what is happening is I am keeping my body completely straight. There is no compensation, nothing is there, as well as my pelvis is not dropping. But let's see what happens with this patient. Now just stand on this side and lift this leg up. Perfect. So as we can see over here, see there is a compensation over here. We can see there is no complete pelvic drop, but we can see that patient is leaning towards that side and also not able to maintain the balance on this side. Also, do you get any pain over that side?
Yes.
Okay, so patient also complains of pain when standing on one leg. So that again clarifies that yes, there is some weakness in the hip abductor muscle. There is not proper complete weakness, but some weakness, because of which we can notice some compensation from the trunk. Now let's check on the another side what happens. Okay, now weight bear on this side and lift this leg up. Okay, well this side also we can see the same compensation. The trunk is shifting on that side to maintain this pelvis high. Okay, so both the sides hip abductors are weak, that we can come to a conclusion. Now I know that most of you will be complaining that no, Trendelenburg sign positive means whenever you try to lift off the leg, it has to drop like this. Yes, that is Trendelenburg sign, but in normal scenario, when you are seeing clinically patient, you will see that patient is performing compensation of it by shifting the trunk towards the same side, and that is what we observed over here, and on that basis I am saying that there is a weakness of hip abductor muscle. So I hope things are clear that way. Okay, now there is one more thing that we should not do. Why? Because patient is having severe pain, but I'll just show you why we should not do. Let's say I want to check whether really lower abdominal muscles are weak or not. So for that we can just try to check the MMT. We will raise patients both the limbs together up, and then we ask the patient to control it and take out the support. Just slowly reduce. I am just going to take my hands. Okay, you have to try to control it. Okay, 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 relax. As you can see, there is a severe pain for the patient while performing this, and also patient is not able to perform or maintain that position for longer duration of time. So if you do this, what we are doing is we are putting more pressure over the affected area, and that might cause over injury also. So that is why, guys, please avoid doing this on the initial assessment. Once patient's pain score come down, then only you should check for the MMT for lower abdominals or any other muscles. So on the basis of assessment, what we have done so far on the observation, palpation, examination, special test, everything, we can come to a conclusion that yes, definitely there is a L4, L5 nerve root compression posterior laterally on the right side, because of which patient complains of tingling numbness on the right side, as well as there is weakness present for the L4, L5 myotomes. And plus also there is a tightness in hamstring muscle, so that also we have to recover, and there is also weakness in the lower abdominals, so that also we have to work on. So I really hope that you have understood the case and how to take the assessment of the patient when they come to the clinic. What all points are most important. Part with the treatment of the patient, just wait for few more days, and till then if you have any other doubts, do let me know in the comment section. And yes, thank you so much for being so patient and cooperating. And once again, thanks from our viewers also for taking part in this video.